Hi, and welcome to our series on education about gymnastics, sports medicine, and performing arts medicine injuries at home. My name is Gina Pongetti Angeletti, and I am the owner of MedGym.net, as well as a chief physical therapy and a proud partner in NeuroTour Physical Therapy Chicago. We're here to make sure that athletes of all performance arts sports, and even some other sports that this applies to, are educated enough to make sure that they prevent spine injuries, shoulder injuries, and hip injuries. Today we're going to talk about something that I coined in 2003 in my time with USA Gymnastics National Healthcare Referral Network staff, as well as traveling with our national team and working meets and trying to get into the depths of the etiology of injuries with figure skaters, with performing artists, circus artists, gymnasts, dancers, cheerleaders, and all types of performing artists. Hinge Theory is essentially the concept that shoulder flexibility, joint work, and pliability in combination with hip mobility, flexibility, and pliability, adding in the strength and how you use both of those with proper kinematics, as well as spine motion, available motion, and health, intersegmental mobility, creates the ability for you to either increase your risk of spine injury or decrease your risk of spine injury, most of the time in stress fractures, end plate reactions, category injuries, spondylolisthesis, spondylolysis, etc. And the idea behind the more motion that comes from all of the joints, the less likely one specific joint is to have all of the brunt of the force, thereby creating local stress reaction. Very simply, I will do this and explain it first to you. If you have a slinky in your hand, and slinkies have lots of pieces that when you open them up, they're supposed to open in equal opportunity, where the bottom is the base, and the opening at the top is how widely apart each one is. The spine, when bent and opened, should open like that. Each individual level, when you're arching, should open more than others. If you're a healthcare provider and you understand this, obviously, cervical spine, thoracic spine, lumbar spine, and sacrum all have different aspects of actually opening versus closing based on the facet joint alignment, transverse process, positioning, etc. However, for the lay public, for coaches, for athletes, for everybody else, it's essentially a matter of when a curve forms, you want the curve to form not as a sharp aspect, but as a round aspect. If each level of, let's say, 80 total degrees needs to happen, and we have 8 levels, if each level does 10 degrees of whatever their opening is, then there is no stress point. If at one point in time when you bend backwards, this segment doesn't move and this segment doesn't move, and let's just call this your L4, when you're bending backwards does move, you then have a hinge point or a stress point. Pretty conceptually based on physics, conceptually based on arthrokinematics, or the study of joints in motion, and when motion is combined with actual structure, what happens? So how do we dumb this down, if you will, for our athletes to make them understand the importance of shoulder flexibility and hip flexibility, posture, strength, stabilizing exercises, and most importantly, preventative and anticipated manual therapy for lats and hips and spine to make sure that that motion stays while your strength increases? Well, we're going to talk about that today, so here we go. Everyone stand up, and you can do this with me if you're interested to check your motion. First things first, let's talk about the spine. So you have a cervical spine that bends backwards. You have a thoracic spine in the middle that naturally rounds forward. You have a lumbar spine, we call it lordosis, that naturally opens. And then your sacrum naturally curves under. Of course, your cervical spine is meant to be able to look up and around. Your lumbar spine, especially in performing arts, has to have a great amount of bending forward and bending backwards. Your thoracic spine, although forward, can reverse to neutral. It's more difficult to actually get way past neutral. And then your sacrum does something called nutation and counter-nutation, where when your back arches, your sacrum goes further down. When you round, your sacrum comes further back out. So when you're doing things like a finishing position, when you're doing something like an arabesque or lifting, your lumbar spine takes the brunt of most of the arch, but also your upper back needs to be able to open in order to make it look nice. Let's do aesthetics first. If I have somebody and they don't have good shoulder flexibility, and they lift their arm over their head and they go to kick backwards and this is all they get, it doesn't look very big. Now, whether this is choreographically in figure skating or dance or in gymnastics, either way, it doesn't matter. If I take my hip and I open it and I open my shoulder backwards and I open my chest opens and my lumbar spine opens, I get a very nice C curve or an arc that goes from my fingertips all the way down to my toes. When we're doing warm-ups, right, and going back to choreographers like Twyla Tharp and everybody else, ribs are so important in understanding how to round them and open them, making sure your pelvis goes under and back, making sure your spine opens, opening in the back, and then rounding and opening in the front, all very important. The hard part about this is normally when someone bends backwards, if you have them stand in the clinic and put their hands on their hips and bend backwards, they're going to do so for the simple purpose of not wanting to fall over. So instead of standing there and going like this and thinking that they're going to bend backwards, they literally stand, they make sure that they shift their weight forward as much as possible, and when they bend backwards, they actually bend backwards and they push their pelvis forward. Now, my spine is not perfect, 2 stress fractures from doing gymnastics, so I don't know that my motion is the best. However, let's take a look. When I bend backwards, you can see how straight my upper spine is and how straight my lower spine is and how right about there is a spot, right, that it hinges. We'll talk about this and potentially link at the bottom of this video to a bunch of PowerPoint presentations and pictures on assessments of other kids that we've done where we can actually see where that angle is. Essentially what we want when we're bending backwards is for there to be no hinge point, no skin fold. We want the spine to be able to form a curve. How does that happen and how does this relate to anything performing arts? If you're talking about figure skating, about any sort of glide motion, if you're talking about any sort of arabesque in dance, or choreography in gymnastics, or switch leaps where your leg is flung backwards behind you, right? What you want is from fingertip to toe for there to be an opening. And how does that happen? The shoulder joint has to open, right? So your lats, which are strong enough to pull you forward, your abs, your intercostal rib muscles, which pull you forward, need to be flexible enough intersegmentally within each single level to allow your shoulder to come up. Muscle flexibility, number 1. Number 2, joint integrity. If you're lifting your arm up and your joint doesn't work ball and socket wise, you'll pinch at the top, therefore hiking and disallowing your shoulder to actually be able to go further back than vertical. If this is 160, this is 180. We want people to be able to get past 180 with their shoulder without arching their back. If I have somebody in a clinic, and I'm just going to use this bar as an example, and I have them stand and lift their arms over their head, they do this. They arch their back, they open their ribs, and they say, see, I can get my shoulders behind my head. Now we're going to do it where your back is completely flat and your shoulders are neutral, right? Anatomical neutral from lateral. Now I'm going to take this and I'm going to lift it over my head as far as I can. I feel, or the therapist will notice, that the person starts to cheat. So they start to move their back. So then we correct them again. And now that's as far as I can go back without using the bar to move my shoulders and everything else. And that's essentially where someone would be measured for shoulder flexibility. So number 1, muscle flexibility. Number 2, joint integrity. Number 3, quality of motion. And number 4, strength, okay? So no matter how inflexible someone's postural muscles are, like men's gymnastics, right? You need to make sure you have the strength in the back to make that reverse itself. no matter how strong a muscle is, it cannot make the opposite or the antagonistic muscle actually more pliable just by trying harder to get it there. You get impingement, you get forced pain, etc. Same thing as the hip. Let's do an example. If I stand and someone says extend your hip, most people will lean forward so they can counterbalance. Then I say, hold on. Now I'm going to extend my hip, and while extending my hip, clearly I'm arching my back and opening my shoulder. Now I am going to stand straight. I am not allowed to move, and when I move my hip, the first sign of turning out, which is what people do in their split positions as well as leaps, and the first sign of arching your back, you have to stop. How do you measure that? Best way to do it, put somebody up against something, right? Ideally, the table would be at about my hip height, and then when you actually go backwards, and if you feel like you are starting to arch, or if you feel like your hips don't come in contact with whatever you are standing against, that's about your active hip extension before you actually get a functional motion of extension that involves lordosis of the lumbar spine, the opening or reversal of the kyphosis of thoracic, and essentially functional motion as opposed to exact motion, right? Let's go over to the wall real quick. Some tricks that you can do to really teach your athletes or teach yourself how flexible and pliable your shoulders really are. So if you're standing up against a wall, what you want to do to leave room for your glutes, if you will, because otherwise you're just going to tip forward, is you can step away about half of the distance of your shoe away from the wall. As you do that, you can put one hand behind your back so that you maintain neutral. Now, as soon as I take the arch out of my back, breastbone to pubic bone, round forward, and maintain neutral, my knees have to be straight or just slightly unlocked. As soon as I do that, I naturally will move forward because my posture. So your shoulder blades and head have to be touching the wall, hand open, turned out, externally rotated on the wall, and your back has to be flat. Now, while you're in this position, what I want you to do is take your arm and move it over your head. As soon as I get to about here, if I go further, I can pull my hand out from my back, meaning that my spine, my abs, and if they're contracted and I'm in neutral, that's as much flexibility as I have. Typically, people will go against a wall and they will hold it and they will go like this. And as you see right about here, I go here and I have to tilt my back or arch my back open in order to get my hands to go back. This angle, I'm not moving. If I turn to the side, is not 180. This angle to this angle is not 180. There, you get closer to 180, but as soon as I arch my back and my ribs tip forward, it makes it look like I'm actually straight, but I'm not. Another way to measure. Lay down on the ground with a slight bend in your knee. Again, you can check your neutrality of your back and you can just put your arms over your head. Some people literally, and I'm just showing you, can't even let their arms go flat while their abs are tight and their back is neutral. If I let my back go and lordose my back, thereby flexing my hips and tipping my ribs backwards, it makes this angle decrease, which makes it easier. If my ribs close down, my humerus to rib angle then becomes very difficult for people that don't have flexibility. If you take a bar, you can do the same thing and you can go over your head, but somebody else has to have their hand underneath you to make sure that they can't pull it out, meaning that there is still compression to the hand being done, right? This is a good exercise to do to check. This is also a good exercise to do to make sure that kids understand and athletes understand where that is. To make it even harder and test the strength aspect of it, the first thing that you would do in measurement is lay somebody on their stomach so that their axilla or their armpits are at the edge of the table. While you're at the edge of the table and you go to lift, this is what gyms do in dance studios and everything else, and they're using their back muscles and everything. If you want to target your upper spine muscles, your rhomboids, your paraspinals, and everything in between your scapula that actually help to reverse the thoracic kyphosis into neutral or even a bit of lordosis, you want, when you're measuring, to make sure your chest remains flat, and from a side view, the side of your ribs is parallel with the table. As someone lifts, they'll lift because they get here and don't think it's high enough, and then they cheat and they start to lift. You can even put your hands on their lower paraspinals to make sure they're not active. Very simply, when they're on the ground, lifting arms only is where your active strength flexibility is. This is as high as I can go without having a cheat moment happen, if you will. Now, from a goniometer perspective, you want the top part of the goniometer to be on the arm. You want the bottom aspect of the goniometer to bifurcate or split the ribs completely neutral. Now, this might be a bad example, but I'm going to show you and see if I can do it. Right? Here's my shoulder flexibility, right? If I go backwards, and every time I go backwards, all I do, it matches now my arm. If I go backwards and I think I can go further back, nope, but I can't, right? There's my flexibility. If I really, really, really want, or a coach tells me my hands have to go behind my body, I can very easily do that by doing this. But look at what's happening. Goniometer remains on my body. That angle is the same exact angle. I'm not opening anything. All I'm doing when reaching backwards is tilting. If I wanted to truly open, right, I would not arch and I would pull my arm backwards, thereby increasing that angle. That angle right now is 160 measured. 160 is no good. 180 is vertical. You need how much to go backwards to make sure that your hands lead you in a back walkover or back handspring? More than 180. If you are going backwards into your Yurchenko vault, you probably want at least 10 degrees further, etc., etc. So if we are doing measurements of the hip, you can do this in many different ways. Hips are pretty difficult to measure just because of understanding exactly where that hip motion in measurement is. You can have somebody stand against, again, something so that their hips are against a flat surface, and then have somebody watch from the side to see if they're arching or not, so that when they lift their leg back, you're actually getting true motion. Once again, no, look at how much further I can get if I turn out, right? You have to be able to go straight backwards using your glutes, which everyone uses their outside, their glute med instead of the back, glute max and glute min, and they arch their backs. Another way to test flexibility as well as work on flexibility is something called the Thomas position, or the Thomas stretch. Now, from a measuring perspective, this is very interesting, because the more that the top leg is pulled back towards your chest, the more difficult it is for the bottom leg as a wishbone to be split. The pelvis is actually made of two things, and in between those two things is a disc in the front at your pubic bone, and in the back is your upside down triangle of your sacrum. Pelvis moves like this. So as I am moving backwards, if I'm blocking one pelvis by pulling my leg up, the other one is going to have a more difficult time moving down. Hence why the Thomas stretch works, because you block one side to make it so that you can isolate the opposite hip and stretch. If you are going to measure this to be completely repeatable and reliable, you want to make sure that the opposite leg is at the same block angle as the bottom leg. Let me show you. You sit on a table and you bend backwards, your thigh is going to run into the table. So you need to almost be at the edge of the table. Never go backwards without the protection of the opposite leg to make sure that your spine is healthy. When I go backwards like this, that's about where I am. It's like a diving board. It's like a springboard. I want to turn out. I want to flop down. If I let this go, it obviously goes further down, but that's not hip flexibility because my spine is not at neutral. So whoever is blocking your other hand, you can have your hand underneath their back. You can have their leg pulled all the way up to their chest. You can measure this angle. Maybe this is 145, I don't know. But this block angle has to remain the same if you are going to measure how far down their hip can go. Now let's just say, for intent and purpose, I'm going to do a 90-degree block, because at 90 degrees, if I maintain 90 and my back is flat on the table and I'm neutral, I get my hip to where? let's just say that's 0. I don't know that there's any extension in that past neutral. If I'm too far up, it'll obviously be -10 or not even to neutral, and if I let it go, I can look more flexible. So if you're measuring, important to do it repeatable. If you're stretching, it doesn't matter. You block this leg up as much as you can. If this is easier, if people are really inflexible, they can put a towel. If you have a partner, they'll push against your foot while they're actually pushing down on your leg, and that stretches the entire front part of the hip. Let's talk a little bit about the anatomy of the hip. Let's do another game. Okay. If you're standing and you have your hands, your fingertips on your ASIS, which is the pointy bone in the front, and your thumbs wherever they land on the back. They may land on your PSIS, which is the top aspect of your upside down triangle, your sacrum. You're standing. Pretend like your hips are a bucket. I want you to take your back and I want you to lordoze your back or arch your back, and notice what happens to your hands. 3 things happen, right? As I lordoze, my thumbs rise, my fingers drop, and my pelvis tips forward, like I'm actually taking a bucket of water and dumping it forward. Again, I'm standing, I'm holding a pelvis, and I'm arching my back, which makes it tip forward, right? So I'm tipping my pelvis forward when my back is arching. We're gonna do the opposite. Here's your breastbone, find your pubic bone, take those 2 points, bring them closer together, right? Don't lean forward, but take your pelvis, take your pubic bone and bring it up towards your breastbone, which is a contraction of your rectus abdominis muscle in the middle. You're taking your pelvis and you're now tipping backwards. What happens? Tipping backwards. My thumbs drop down, my ASIS rises up, and my bucket of water tips backwards. The lumbar spine can go lordosis, or each lumbar spine segment open, or can actually go into further kyphosis, which is not natural for where the position of lumbar spine is, and round forward, right? Example of injuries with this. If a gymnast over-rotates on a double back, or they land and they peel off bars and they land on their back with their feet slammed over their head, often we talk about an end plate stress fracture, right? Because when you're laying down and your legs go over your head, your spine is essentially reversing its lordosis and rounding forward in such a manner that the ends of the actual joints in the spine bang together and can create bruising or fracturing. Just small tidbits of info. So now we're holding on to our hips. We're going backwards, we're going forward, and notice that this is much more comfortable for dancers. This is much less comfortable. Talked to Travis Wall about this with some choreography. We've talked to other very famous choreographers about how important full available motion of hip position and rib position is in making a motion such as this look like this, or making it look like this, which gets you a rounded forward, which gets you the ability to contract and show sadness and show emotion, especially for skating. Nobody wants to stand on the ice and look at somebody doing this. You want to see somebody round forward and open. Same thing. The more each individual segment of your spine moves and has ligamentous availability, has muscle availability, individual rib motion where those ribs can open like bucket handles and close, the more emotion you'll be able to talk about, but also, most importantly, the more injury prevention you will be able to allow your body to potentially have. Hinge theory, right? Let's talk about the practicality of an arch. Pretend like I'm laying on my back, and I push up into a back bend, and I'm going to go into bending backwards, right? I am going to go from standing position into a back walkover. I am going into a switch leap where I'm opening. I'm going into an arabesque position. I want my upper back, my shoulders, my hips, and my spine to all take a part in the job that needs to be done, which is to form an arc. If my shoulders only go to here, and my hips only go to neutral, but I need to get my hands back and my feet back, it is all gonna come from your spine. It looks like my hand is going further back. It's not. It looks relatively like my leg is going further back, but it's not. I'm not lifting my leg. I'm just using my back to get that hinge. Why does that matter? It causes injuries, disc injuries. There's discs or eggs in your McMuffin, if you will, that sit in between your joints. Every time one arches backwards, the disc is pressured in the back and pushed forward. Every time one rounds forward, the disc is essentially wedged forward and pressured in the front, okay? Every time that happens and the body does not want to be bending, the spine essentially, which is a bunch of pieces on top of one another, with a thing in the middle that holds everything together, right? So they stay together. They have wings on them like airplanes. So if I'm an individual facet joint, if you will, and here's my transverse processes, here's my spinous process in the middle, right? My body has to be able to move if I rotate. If I bend sideways, they're gonna bang into each other, which is why side bending often comes with either extension or flexion so that things can't touch. When I bend forward and when I bend backwards, if each individual segment only does 8 to 10 degrees, nothing is going to eventually bang into the next level. If one segment particularly does too much, you often create pars articularis fractures, spondylolisthesis, spondylolysis, or spondycategory injury, which is a predisposition to the spine actually stress fracturing or shifting when this piece breaks, causing what we see on film as a Scotty dog, or when it shifts forward. It is the most common injury in performing arts is chronic low back pain that goes undiagnosed. And the second most common injury is actual spine injuries in the sport of gymnastics that sometimes have a really difficult time recovering, because instead of therapists and athletic trainers, physical therapists, doctors, osteopaths, etc., chiropractors, looking elsewhere to the mechanics and the reasoning as to why this person got where they got, they look to the point of pain. Important, albeit, right, to calm down the guarding, to release the psoas and the hip flexors, because your hip flexors, when they tighten, right, they actually make you go into a lordosis position. But more importantly than that, years and years and years of doing something the wrong way, if you fix the pain and you put them in a brace and you let them sit for days or weeks on end, it doesn't fix the fact that when they go back to the sport, no matter how strong their abs are, it's not going to get better. Time and time again, we have people fly in from all over the country. We do video visits, we do out-of-country visits with other national governing bodies on why this is happening, why it's repeating. Why is my elbow pain continuing to happen? Well, if your shoulders aren't flexible, every time that you land your back handspring, you're jarring and jamming, as opposed to there being a point of verticality where the bones can actually load the way that they were meant to be. So all in all, look at videos, slow-mo side view videos of board to vault for pre-flight for your taekos, and see, where is that going? Am I going only to 160 and my back is getting my hands all the way back? Watch somebody's impact point on a back handspring contact on beam. Watch somebody when they release for a Tkachev or do a Tkachev timer, have them put on a sports bra and bottom so that you can see their back and see what's happening to their actual spine when they're forced to go into an open arch before release, right? Watch somebody when they're doing leaps as dancers. Watch their active arabesque position, watch their open arabesque position, watch a develop A position, and see what their spine is doing, see what their shoulders are doing, and see if you can go back when someone's injured to the point where you can tell that their kinematics is off. Now, after the fact, making sure that manual therapy is done, ART for scar tissue and myofascial restriction release, joint mobilization, McKenzie techniques for intersegmental motion, trigger point dry needling to make sure that each level of muscle layer, and this gets deeper as the needle can go deep, is released enough to allow the body to go backwards without guarding, right? Making sure that grade 1 and 2 joint mobilizations are done to teach the body that repetitively over time, the ligaments don't have to guard anymore if there's no local pain, if the forces throughout the spine are spread, okay? What does this lead to? Lots of hip issues, hip impingement, low back pain, PSIS pain when someone is leaping and they're turning out constantly. You can see if I lift my leg back behind me straight, how it's just arching, but as soon as I rotate out, how it really jams in this side of the back and the top of the PSIS. Shoulder impingement, irritation with arms going up, clavicle issues, and there's so many to name. But watching motion and seeing that it happens properly is the most important. Thank you so much for watching this. Please go to medgym.net and visit achieveorthosports.com and make sure that we can continue this journey together on prevention, motion assessment, and making sure that our athletes stay as healthy as they possibly can. Please click below on the links so that you can watch further PowerPoint presentations, video and picture analysis of actual clinical cases, and tune in info at achieveortho.com or visit our website and you can contact us that way too. Thanks and have a great day.